Hello, in this lesson we're going to look at the Frankel scale, domains of behavioral management, and the verbal domain. There are many techniques commonly used to manage the behavior of children in a healthcare setting. These are subdivided into domains which are often used in conjunction. In this lesson, we're going to discuss the behavioral assessment of pediatric patients and to list various domains of pediatric behavior management. We will also explore in greater depth the first and most commonly used domain, the verbal domain. One of the most common scales used to assess the behavior of pediatric patients is the Frankel scale. It allows the communication and recording of the behavior of a child patient during visits and specific procedures. The scale ranges from 1 to 4, with 4 for the cooperative patient and 1 for the patient uncooperative with any procedure. There are 6 domains of pediatric behavioral management, namely the verbal, non-verbal, rewards, aversive, physical, and pharmacological domains. There are several different techniques in each of the 6 domains. Additionally, the different techniques are sometimes characterized into basic and advanced techniques. The advanced techniques are usually only employed by specialists. The verbal domain of behavior management consists of 3 techniques that rely heavily on communication. They are tell, show, do, modeling, and distraction. As such, it is important to evaluate the language development of the patient. Usually, only children with language development age of 3 and above will be able to communicate at a sufficient level for a healthcare worker to employ techniques in the verbal domain. Tell, show, do is a technique in the verbal domain described by Edersland in 1959. It is a 3-step process to explain a medical or dental procedure to a child patient. The procedure is first described in detail, the tell. Then the procedure is demonstrated in a non-threatening way to the patient, the show. Then it is carried out on the patient once he is comfortable, the do. To illustrate this further, let us look at the procedure of dental prophylaxis or teeth cleaning. If a child is having his teeth cleaned for the first time, here is how we will use tell, show, do. First, describe it as, we are brushing your teeth with my electric toothbrush, while showing the dental handpiece to the child, even running it to describe the sounds he will hear. Next, we can show the child by running the handpiece on his finger, to show that it is not as scary or painful as he has imagined. Finally, we can proceed to clean his teeth, perhaps starting with the front teeth, which are easier to accept. Modeling is another verbal domain technique by which a child experiences an unfamiliar setting or procedure by first seeing it happen to someone else. An older sibling can be very useful in this situation, but only if the sibling is well behaved. Remember that negative behavior can be modeled too. In situations where no older siblings are available, flip charts and videos can be an effective stand-in. In fact, videos and pictures can be sent to parents before the visit to acclimatize a patient coming for a new visit. The next verbal domain technique is distraction. Distraction can be a very effective technique to try to keep the mind of your child patient off an unpleasant procedure. It is most effective when using topics that the child is interested in. Pay attention to what the child is wearing or carrying when they enter your operatory. This can help clue you into what he may like. Additionally, the use of movies or the iPad can also be very effective in unpleasant situations. However, do remember to check if it is appropriate with the parent first. Before we end the video, let's recap. The Frankel scale is a mean of communicating the behavior of pediatric patients. There are 6 domains of behavioral management in children. These domains are often used in conjunction, and some of the most commonly used techniques are in the verbal domain. It is important to note that only children with adequate language development will respond to the techniques in the verbal domain. Hello, welcome to understanding the non-verbal and rewards domains. In this lesson, we're going to explore 2 of the 6 domains of pediatric behavior management. namely the nonverbal and rewards domains. They are often used in conjunction with the verbal domain when treating pediatric patients. We will be exploring in depth the various techniques that make up these domains. The nonverbal domain consists of two techniques. The first technique relies on nonverbal communication, which uses body language. The second technique relies on good procedure planning, which involves desensitization. Body language is a powerful form of nonverbal communication. Children are able to pick up upon your fears, and in many instances, an inexperienced practitioner may be more afraid of a child patient than the other way around. It is important thus to project confidence and show no fear when treating young children. This is, however, easier said than done. The other aspects of body language are easier to master. However, you will need to be mindful about what you are projecting. A smile is one of the most powerful body language. Be sure to greet a child patient with one on your face. It can make a world of difference. As such, it is important to make sure that a child sees your smile in the first place. Do not greet a child with a mask and gloves on. When a child can see you, it helps the child identify you as a human and avoid excessive white coat syndrome. Additionally, other small actions, such as greeting a child at eye level by bending down so that you're not towering over him, and asking the child questions instead of focusing on speaking with the parent, can go a long way in establishing trust. Another nonverbal domain technique is this systematic desensitization. It is a type of behavior therapy designed to help a fearful animal, such as a dog, to progressively relax in the presence of something that causes fear or aggression. The main idea is to progressively teach the dog to be calm around the trigger and never make the dog react in a fearful or aggressive manner. For children with slow to warm and difficult temperament, planning for systematic desensitization can allow for the accomplishment of tasks that were impossible before. This is especially useful in children with autism, who thrives on repetition and routines. By introducing incremental and repeated exposure of stimuli related to a procedure, a child can be desensitized to a point where the procedure can be performed. However, this requires the buy-in of parents, as this could require multiple visits without any treatment done, resulting in a significant time investment. This could also be done with the prescription of exercises for the parents to conduct at home to aid in the process. For example, a disposable mouth mirror can be issued for the parent to conduct mock oral exams at home to allow a dentist to examine a child previously not amenable to it. Another domain used in behavior management is the rewards domain, consisting of positive and negative reinforcement. Positive reinforcement is geared towards increasing a desirable behavior by providing wanted stimulus. This can consist of physical rewards such as stickers and small prizes. Nonetheless, do not underestimate the power of verbal rewards. In fact, consistent verbal reinforcement of wanted behavior such as "thank you for keeping so still for me" and "you are doing such a good job opening so big for me" can be more powerful than a physical reward at the end of the session. However, do not resort to bribery. The approach of "if you get on the chair and I'll give you a sticker, and if you open your mouth you get 2 more" means that the rewards will have to increase in magnitude every time, resulting in the decrease in the value of the reward. On the other hand, the use of negative reinforcement is increasing of desirable behavior by removing unwanted stimulus. However, the use of punishment and scolding for negative behavior can be frowned upon by parents these days and should be used with caution. You can use contingency escape, which is to provide the child an avenue to stop treatment if it becomes uncomfortable for him. For example, telling a child to raise his hand to pause treatment if the procedure is uncomfortable. This allows the child to retain a sense of control, thus able to go through difficult procedures. To recap, the use of non-verbal and rewards domains are helpful in managing pediatric patients, using the technique of body language, desensitization, positive and negative reinforcements.